Hi guys, good morning. So as a continuation of the first video lecture that I sent to you about uh, triage and tagging, so we were actually talking about START, simple triage and rapid treatment, which is one method that we use in doing triage, or sorting of the victims. So when we do, so I will move on and continue with so as a review about initial assessment. No, so when we do initial assessment, it's very important that you need to stay calm. No, kalma lang. You look around and get an overview of the scene. So stay calm. No, compose yourself, make sure that you are able to observe properly what is going on. You get an overview of what happened. Okay. And this visual survey. So we are actually, so as you do that, you are making a visual survey, right? So this visual survey gives you an initial impression of the overall situation. So this will give you an idea of what could have possibly happened to the victim. So this will include the potential a number of patients, how many victims are there, how many people are involved, and even the severity of the injury. So how severe are the injury na nakuha sa atong mga victims? How many are severe? How many just had these minor injuries? And also, this visual survey should enable you to estimate initially the amount and the type of help needed to handle the situation. So, unsa man, what is the type of help that I will need for me to be able to rescue or help this victim? How many people do I need to assist me in helping this victim or moving this victim from a dangerous area to a non-dangerous or to a safer area? Okay, so next is you need to do an initial report. This initial report, you are just actually creating a verbal image. You're creating a verbal image of what really happened. You're creating a verbal image of the actual situation. So the initial report is often the most important message of of a disaster because it sets the emotional and operational stage for everything that follows. What does it mean? Often kuno the most important message of a disaster because it sets the emotional and the operational stage for everything that follow. The most important, pinaka-importante nga message kuno that you will relay during the disaster. So this initial report anhi mag-base no ang ato ang medical team kung unsa nga help, unsa nga treatment ang ilang mahatag sa mga victims. Okay? So as you prepare to give them the first vital report, always use clear language, no signals or radio jargon, be concise, be calm, and do not shout. And then, okay. So now, what's the reason? Why is it necessary that you're not, you're calm, you're not shouting as you give your initial report? So this happens as you call, as you ask for help. You will be calling 911 because you will be needing assistance. You'll be informing them what treatment these victims will be needing. Okay? So, importante ka nga di ka magsyagit. Of course, if you will be shouting, how will this 911 dispatcher understand what you're talking about? No? If you're too emotional, no? Grabe ra ka ka-emotional, grabe ra ka nadala ra ka sa situation, then that will not help. Okay? So, be calm, make sure that you speak clearly, be concise, no? Of the assistance that you need. Be concise, no? Be clear about what happened. Unsa may imong na-observe? Unsa may imong nakita sa mga victim? Okay? So, the visual survey should help you estimate the initial amount and the type of help needed to handle the situation. So, the type of help, estimate ko no kung unsa nga tabang. So, for example, through this initial assessment, mabal-an nimo there are actually three people here. who has severe bleeding. No, one actually the leg of the other victim has been separated from the body, meaning severe bleeding din na siya. And that is an immediate meaning an immediate help is needed for that. Because that's severe bleeding. Or there is one victim who is no longer who doesn't have a pulse, it doesn't have a breathing. Okay? So if you're able to relay that message clearly, no? So the medical team or 911 will now be able to identify kung unsa nga kinahanglan nimo, what are the equipments that we need to bring, how many ambulances do we need. Okay, so that is very important, that's very vital when you do your initial report. Okay, now what are the key points to communicate? What are the key points to communicate? What are these very important information that you need to give them? So first one is the location of the incident, of course. No, you should know asa man idapita na hitabo. If you're not familiar with the area, then at least give them a landmark. What's the nearest landmark? What's the nearest building nga naa diha, or what's the name of the road? No, if you can see there a sign, no, which says the name of the road, then you give it to them. Okay. Now, what is the type of incident? What is this? Is this fire? Is this a motor vehicular accident? Is is this a crime scene? So, dapat klaro ang imuhang pagka-describe. And then, are there any hazards? When you say hazards, are is there a possible situation that could hinder you from helping out the victim? Or is there a hazard, or is there something that hinders you from going near the victims? Or is it dangerous for yourself, no, to be helping the victim? So those are the possible hazards. So you need to tell them. It is a bit difficult for me to approach the victim because they're actually in the middle of the highway, and there are a lot of buses, no, and trucks going on and or passing by. So it is a bit difficult to move them. So we need assistance, no, highway police probably, or the firemen to help stop the traffic or control the traffic in that area. And then approximate number of victims. Do not just focus on one. If you see one, there's a possibility that there are other victims in the if it's a motor vehicular accident, there is a possibility that there are other victims inside the car, or base na ay victim na nalagpot, no, away from the area. No, so you need to make sure, you need to check. And then the type of assistance required. So unsa man nga mga assistance ang gikinahanglan nimo. So take note, guys. So be specific with your request. No, again, be specific. The field experience has shown that a good rule of thumb initially in multiple or mass casualty situation is to request. So this is now with regards to the number of ambulance that you'll be requesting. So take note, guys. One ambulance could accommodate 5 victims. Okay? So, sa kaambulansya, 5 ka-victim ang maka-accommodate nila. So, if you have 20 victims, you need 4 ambulances. You need to request 4. If you have 12 victims, you need to request for 3. No? So, ingon ana. So, dapat focus ta. Para makabalot ka. What will happen if you requested for only 2 ambulances and the victims are like 14? So, dili na hinuon makarga ang uban. So, you will not be able to transport the other 4 victims because one ambulance could only accommodate 5. So, what will happen what if those remaining four are also on an immediate, also needs immediate care? So, possible na, unsa man, basin, no, mamatay na hinuon sila because they were not transported immediately. So it's very important that you know the type of help and the assistance that you will be needing. So before you start, take several breaths. It's not easy to be a witness, no, on an emergency situation. So for us to stay calm, for us to stay focused, take several breaths to give your mind to catch up. No, okay, nangurog kag maayo, it's normal. That's a normal reaction of the body, no, especially during emergency. Now, you take a deep breath, inhale, exhale, and then let your mind catch up on what is going on. Okay? Para active ang mata, active ang utok, kalma ta, dili ta kita gasyagit-syagit diha. Now, I will be giving you an example of a report. Okay, so this is an example. So, assuming a witness, no, of an emergency is trying to call 911 and is trying to make an initial report. This is a major accident involving a truck and a commercial bus on Highway 305, about 2 miles east of Route 610. So, unsay first ang gihatag, it's the location. Okay? Now, there are approximately 35 victims. So, now, the witness, no, or is already giving the number. How many are involved? How many people are involved? So, there are approximately 35 victims. There are people trapped. No, so 35 yun, and there are possible that there are some people trapped. And then repeat. Just to repeat, this is a major accident. Definitely, this is a major accident because there are already 35 victims involved. No? So I am requesting now the type of help and the type of assistance, the number of assistance that you need comes in. No, I am requesting for the fire department, rescue squad, and 7 ambulances at this time. Why 7? Because there are 35 victims. 5 victims in one ambulance. Okay? Now, dispatch additional police units to assist. So, meaning because as what he said, no, there are still other victims possible than a trap. Okay? So that's why he is also asking for additional police assistance. So this is how you give your initial report. So, dapat klaro siya. No? Klaro kayo siya. It should be clear, it should be concise. Next, how do we sort the patients? So it is very important not to become involved with the treatment of the first or second patient with whom you can come in contact with. So ayaw usa, sort usa ta. Kinsay need og immediate care. Kinsa ang minor lang. Kinsa ang patay na. Okay? Remember that your job is to get to each patient as quickly as possible. You need to sort each patient as quickly as possible. Ato na silang isort dayon para mahatag dayon kung unsay treatment na gikinahanglan nila. Okay? For us to be able to conduct a rapid assessment. Okay? Pas-pas na pag-assess. Pulse, breathing, negative, negative, immediate. Okay? Pulse, positive, breathing, negative, no? And then mental status, check data RPM. So, ingon ana, pas-pas ra. And assign patients to broad categories based on their need of treatment. So, you could not stop during the survey. Kung do not stop, nakasort, nakaglima, then you stop. No. Continue. Finish everything. No? Except, no? Do not stop ko, no? Except to correct airway and severe bleeding. So, let's say, for example, on the fifth victim, pag-assess nimo, no? Wala siya breathing. Then you need to open the airway first. And then you assess if immediate ba na siya or minor lang siya. Siya ginhawa. Then pag open nimo sa airway, chin head tilt, chin lift, no? Pag open nimo and then you place the victim on recovery position, dito na ta. Ato na siyang i-categorize. Okay? And then your job is to sort, no? You do triage to the patient. Other rescuers will now provide a follow-up treatment. So, kung mauna, your job is just to sort, focus on what you need to do. No? Because once it has already been categorized, once the victim is already categorized, problema na sa other rescuers, no? To do the follow-up na treatment sa ila. Okay? So, that is sorting the patient.